Hey, welcome back to Digital Health Live. This is Tim Reha here in studio with Silas Buchanan, who's the CEO of My Health Ministry, or Our Health Ministry.
.com. OurHealthMinistry.com.
So you flew in from Cleveland.
That's correct. Came in a couple days ago. Very excited to be here. It's been a great summit. Met a lot of fantastic folks, and happy to have been invited to participate.
So we were just having a great panel with covering this topic called reaching your consumers off and on the grid. What is that all about?
So it's interesting because the question really begs who's on the grid and who's off the grid, right? And I think that we were invited to come out to this summit. Maybe there was a little assumption about us and my targeted demographic being minority, underserved, being off the grid. Pew Internet Research did a study not too terribly long ago that showed while home broadband usage by African Americans and Hispanics pales in comparison to the white population, African Americans and Hispanics get online via smartphones in more than twice the percentage than white folks do. So, when it comes to being on the grid, I think that this minority demographic is on the grid. We're just using mobile devices to be on the grid.
Interesting. And your story is interesting as you are technically a startup.
We are a startup. Got involved in this a couple of years ago, frankly, after my dad died of a heart attack. And it dawned on me and my sisters that we weren't able to collate all of his information. We weren't able to pull his data together to get second opinions in ways that made sense. And as I began to look at how folks were doing that, the whole notion of health disparities came bubbling up, which I didn't know a lot about, frankly. But after attending, more than a gazillion health disparity reduction conferences across the country, one of the ways to reach this targeted demographic came ringing through, and that's kind of what we picked up on. And what we've done is created a platform designed to reach this targeted demographic, primarily African Americans, through the trusted purview of the church. So we've built OurHealthMinistry.com, and specifically for the AME denomination, which, by the way, is 6,000 congregations and 6 million members worldwide. We've built a sub-portal underneath OurHealthMinistry.com just for them, amechealth.org. And we've now pushed that out directly to that mainline historically black denomination.
What's your business model?
Our business model revolves around a per member per month model, as well as a sponsorship and an advertising model, right? So we did a pilot last summer in New York. It was a hypertension awareness, prevention, and monitoring campaign. And Boston Scientific was very interested in reaching about 1,500 of our targeted folks. And they pay a per member per month fee for us to access and bring our folks to the table for this particular campaign.
So in the panel we had Catherine from Heart Math. Yeah. What was some of the conversations going on?
Catherine has a fantastic model. I loved presenting with her. She's a fantastic person, and what they've got on her side is a way to really regulate your heart rate, get you calmed down, and she'll be on next, and so you'll talk to her directly about that, right? Conversation for me was what I just shared. Some of the questions that the audience asked me were around our business model, frankly, and also I think there's a bit of curiosity about how they can come and partner with us to consistently reach this targeted demographic. There's a lot of folks at this conference that are developing or have developed a variety of interventions to treat chronic illnesses that communities of color are disproportionately impacted by. But they don't have a marketing strategy or a platform that they can work through to reach this market, and that's what we present and what we represent.
Very cool. So as a startup, you have needs. What stage are you at, and what's your biggest ask right now for support?
Oh, you know what? We're kind of sailing along fairly swimmingly right now, but we are looking for payers to partner with and providers. As we move to our next hypertension awareness prevention monitoring campaign this summer, again with the support of Boston Scientific, we'll do that in Atlanta. We'll do it in Dallas and Columbus. And we're connecting with providers in each one of those cities, but connecting with payers is very important to us. So we're looking for payers who understand that we have our arms around a cost reduction and a cost avoidance strategy by focusing on those that drive the costs associated with healthcare in greater numbers than others.
So there's a lot of people here and some interesting the bells. I think the next session's happening. So what's next for you?
Well, I brought my kids and my wife out here with me. So what's next for me is I'm going to San Diego Zoo. But business-wise, we'll do this hypertension campaign in those 3 cities I mentioned, Columbus, Dallas, and Atlanta, this summer. We are going to onboard Alere, onto our integrate Alere health into our platform. So we'll offer connected health devices, medication adherence support, a ton of credible content. So what's next for us is growing our model, right? There are, we'll say 5 mainline historically black denominations representing about 65,000 congregations and 20 million people. And as we've built amechealth.org as a sub-portal for the AME Church, we're going to build sub-portals for those other mainline historically black denominations to reach them as well.
Very cool, very cool. What's your website? How do people connect?
Yep, you can go right to www.ourhealthministry.com or www.amec for AME Church, amechealth.org.
So that's really interesting and a really good perspective on how to look at all markets to bring your product out and really help a lot of people.
Yeah. Particularly, again, those that are a bit underserved, and knowing that, in the coming months, if not the coming years, through the health insurance exchanges, everybody, the Accountable Care Act, everybody's going to have insurance, right? And so how do you begin to ensure that all those folks that heretofore did not have insurance who are going to have insurance, how do they have, the latest kind of tools, technologies, apps, trackers, right, to manage their chronic illnesses as well? And our platform will act as a conduit for that.
Great. Thanks, Silas, for your time.
It's absolutely my pleasure. Have a great day.